This is the equipment section for your short leg posterior splint plaster. You'll need, of course, tepid water, no hot water with plaster. Slabs or rolls, make sure you have enough so you can do 15 to 20 thickness. Cotton, gloves, scissors, and ace wrap, possibly two if you don't have a double. Stockinette, of course, is optional. You can also use a chucks pad, which you can lay down and have an easy cleanup toward the end. There's going to be the padding section for the posterior plaster splint. You'll need to get your padding and stockinette ready, so cotton rolls, stockinette, and get your patient set up on a table. For this patient, we will be putting them into neutral, which is 90 degrees at the ankle. That is what's being requested, so that is what we're doing. So no Aquinas for Achilles and nothing like that. So you can use the foot stand, and the stockinette is technically optional because you could roll straight cotton if you had to, but the stockinette is definitely preferred. It makes good fold downs, and it protects them from the cotton fibers and lessens the itchiness. Cutting this section out near the ankle joint is important. You don't want it bunching up there, so I would recommend always cutting it out. Opening up the stockinette, sliding them onto a foot stand is great. If you do not have a foot stand for the positioning part, and you need to get them to 90, you can use your thigh. Just put a chucks pad on, either tape it down to your thigh, or just open it up enough where you can hold their thigh on your leg. I did have a little part there that I also removed. If it bunches up there too much, you can just trim it off. Once you got them situated, pick a correct size roll. I picked the 4-inch for his leg size, and go at least 2 fingers past the big toe with the padding. So 2 fingers past the big toe, and then do at least 3 layers there. After that, 50-50 until you get to the ankle joint. The ankle joint, you could do a little extra for the malleolus, and you can even fan fold like I do in the video, some padding onto the heel. That tends to be a tender spot since the posterior splint's going to go right on there. The malleolus gets a little extra padding too because they're bony. After you're past that point, it's 50-50 until you get to the top. Remember, splint's main purposes are swelling control. Stabilization is their second, unlike casts. So you can do a little bit of extra padding. Don't go crazy and put 6-7 rolls in, but definitely you're fine to put 2-3 rolls into a lower extremity. At the top, as you see, another end point. Feel free to go all the way up to the back of the knee with the padding. You're going to be folding it down, so it's fine. And put 3 to 4 layers there because, again, it's an end point, so you want your end points well padded. And that's pretty much it for your padding. I'm moving into the plaster portion for the posterior splint. You're going to want to do a measurement. You can do this measurement with cotton or the plaster roll or the slabs if you have them. Either one you can use as a measuring tool. Once you get your measurement, you can lay it down, and then of course you need to get at least another 15 to 20 more plaster sheets. That's the minimum for the legs, so minimum 15 thickness. To use for the demo patient, we're using a little bit less. He is not a real patient. I think we're only doing 11, so minimum again 15 to 20. That can be more depending on the patient's size, and it can be a little bit less, but wouldn't go much below 15 on plaster. Once you got your measurement, remember you wanted this measurement past the toes by at least a finger, and you want it 2 fingers from the back of the popliteal. These are quick measurements, pretty much 2 inches down from that popliteal to the back of the knee. After you got your plaster slab up, you want to laminate, which is take your index fingers and your thumb and fill in all the holes of the plaster. I start by tacking down the top with an anchor of cotton. Once I get it to where I want measuring wise, I'm using one hand to measure, making sure I'm not too far up where it's going to dig in, and I use the other to hold, and then I anchor it. I am not rolling very far down because you want to roll distal to proximal. I'm just anchoring that part so it's held for me. That way I can grab the rest of it and get it past the toes, and then I can start moving up the cotton that I'm using to tack that plaster posterior onto the body. You always want that posterior right onto the back of the calf. all the way down through evenly through the heel and all the way past the toes, since this is going to be a toe plate. And as you see, you're not going 50-50 with the cotton. You just need to cover up the plaster. So a single sheet just to cover that plaster slab up is all you need. Position should of course be maintained, and for this again we're doing neutral positioning. Once that's done, you are done with your plaster section for your splint. Okay, so we are on our final section, the fold down and finish section. Always fold your cotton individually. This way you can get that cotton over that plaster edging, and then pull down the stockinette. You want to do this because if you were to just yank down the stockinette, sometimes the cotton will bunch up underneath the plaster and leave the plaster exposed, which then can dig into the back of the leg, which is no good for the patient. I do trim the excess off. You could have left it, but it's a good habit to establish, especially once you go into casting. For splinting, you could technically leave it. On the bottom, I'm also tearing the cotton back because on the top of the toes, you want to leave all toes exposed for cap refill to be able to see the toes, clean the toes, check circulation. The bottom will of course have that plaster layer for the toe plate, so they will have the protection on the bottom. And it's at least a finger past the toes. The cotton was 2 fingers past, that way I had a little to fold back over that toe plate. Mind you, they're still on the foot stand. If you weren't able to have a foot stand and they were hanging this whole time, then you would have had to balance them on your thigh to hold that 90-degree position. Also, once you fold the stockinette, you can tape it. I normally use paper tape or some silk tape to hold this down. In this video, I did not. I'm going to just tack it directly on with the ace wrap. But you could tape this down to make it nice and neat to hold. Also, toe plate's a little thin because we only did 11 layers in the plaster section. Normally, you want that 15 to 20. I start by tacking the ace wrap there around the toe area, and then I bring it from the heel all the way through the front, catching it. That way the toe plate is actually included with the ace wrap, and then I go all the way back, tacking it all down on the bottom, because the ace wrap is loose currently on the bottom, so I'm tacking it all in place. Once you get that, of course you move back up, because we always do distal to proximal, so we're moving up toward the body. So if we are pulling a little bit, it's pushing circulation into the body and not toward the toes, encouraging swelling and purple toes, which we don't want. Of course, you'll express to your patient to elevate. It is a splint and it does allow for swelling, but always tell them to please elevate above the heart. Then you will hold the patient here until, of course, the splint dries fully, which with plaster can take anywhere from 10 to 15 minutes with that tepid water. So you would want to keep them here positioned and marveling at your work like I am doing on my demo patient. But that is pretty much it. The posterior plaster splint is completed. Good job.